My name is Gary Shelfine. I'm the Executive Director of Physician Practices for Kennewick General Hospital. Certainly working with physician practices for many years now, a very useful tool is having real-time meaningful data related to our customer, our patient's perception on the service and care that we provide to them. And so being able to have an appropriate mechanism of capturing the spirit of the patient's perspective is an extremely valuable tool for us. And so I've tried throughout my career a number of different options of capturing that data and having it be meaningful, and have struggled to a large degree because survey tools, at least in my experience and historically, have been one that are typically cumbersome to capture responses and getting a high enough numbers for that data to be statistically significant. And then probably even the most disappointing thing historically is the fact that data is aged, and so by the time you get it and you get feedback, and if it's something that's it's actionable on, and you can alter how you're either practicing within your clinic or alter something you're doing from a service standpoint, it's aged. And so having the exposure to SurveyVitals and the tool that we're currently utilizing is really kind of is a breath of fresh air, for lack of a better term. Specifically from the standpoint of having the real-time data in a format that can easily be interpreted and easily be shared with my entire management team, easily can run reports and data for presentation to administration or board of commissioners or the physicians themselves. It also creates a very nice functional tool for the physicians to see their specific data, whereas I can look at some of the big picture dashboards and some of the functionality of that for keeping your finger on the pulse of our operation as a whole. In years past, when looking at just from a financial standpoint, the investment in providing a surveying tool, utilizing some of the big names that are out there, it was a substantial amount of money. And so having this tool, what I would characterize it in enhanced functionality at a fraction of the cost, it's just it's a no-brainer from my standpoint. I mean, being able to have more enhanced, timely data collected in an efficient fashion that's able to be presented to any group, whether it's physician, board of commissioners, or our leadership team, at a fraction of cost, I'm unclear how it gets any better than that.